Today we're going to talk about something that plagues many Americans, and this is breast reduction. Those heavy, painful breasts, that weight down the shoulders where you really get back pain, bra strap grooving, sometimes you get rashes and things like that. And overall, it's difficult, I think, for many women to exercise, lose weight when you have that kind of weight that you're carrying. So this is really your wheelhouse. I'm going to let you run with it, but I do have several questions that we're going to throw in along the way.
I'll tell you, it's very important what he just said. So, a lot of women live with very large breasts, and when they tell people that they're having a breast reduction, people are like, what, are you crazy? People go and get breast augmentations. Why are you making your breasts smaller? And I've heard this so many times from the lay person out there, and it's a really uneducated thing to say. Breast reduction is one of the most common procedures the plastic surgeons do. It is a true reconstructive procedure in a lot of ways. So what it does is it psychologically helps a person, it physically, emotionally, and more than anything, also aesthetically helps a person. So it really has multiple different helpful ways to kind of change a person's life. Because imagine, if I told you that you had an extra 5 pounds hanging off your chest, imagine 5, 7, 10 pounds, take 2 dumbbells, put them on your chest. Imagine what that would feel like. Mm-hmm. Your neck would bend over, your shoulders would be hunched over, you would have lower back pain, upper back pain, neck pain. Sometimes it gets so bad that you're unable to do what are called activities of daily living because your breasts are so big. Mm-hmm. And again, the interesting part about it is this has been done for years and years and years. And the history of it goes back hundreds of years. And there's actual documentation from India and other places where breasts were so big, people couldn't do anything, and they just amputate them. They didn't care what it looked like. Mm-hmm. Up until about the early 1900s or mid-1900s, 1920s, where a free nipple graft, and then not too long after that,
which is actually where you take the nipple off and then graft it back on after the breast is smaller.
Very interesting, because that's one of the most common questions people ask us. They're like, do you cut the nipple and areolar complex off and place it on the table and then put it back after? In all the years we've been in practice, we have never done that, because there are techniques that allow us to keep that nipple and areolar complex on a breast mound and move it around. So
tailor around it. Thank God for the evolution of procedures that occur, in surgery, because we've come a long way.
Absolutely. And the reason we want to keep it like that is because obviously it maintains the sensation and the blood flows better. So you're not going to lose your nipple areolar complex. So, interestingly, just to throw a couple numbers at you, the American Society of Plastic Surgeons said there's about over 70,000 breast reductions done a year. And interestingly enough, there's over 100 techniques. Now, modified techniques, there's a bunch of them. I know that for those of you that are residents or plastic surgeons that are listening, you pick what you like the best. Mm-hmm. And there are so many different techniques with so many different scar patterns and pedicle selection. In our practice, we have kind of mostly do now a modified WISE pattern with either a superior or superior medial pedicle. We feel like it gives more fullness to the upper pole of the breast and makes the breast look prettier.
And really controls the lower pole of the breast where you can really set that inframammary fold. Absolutely. And so, the great thing that you just said, the take home is, especially for all the residents and surgeons out there, you choose the pattern that works best for you. We've used probably 5 different patterns since we've been in practice.
We've done it all. Short scar, periareolar, all of them.
Oh, sure. We've done, from the lollipop to, you name it. And I think that what we have done is we slowly tailored our own procedure. So there may be 100 different techniques out there, and ours is 101, because I like to think that we use a tiny, even from our markings, how we do certain things, we tailor it per patient. But the idea is we've come up with our own way of doing, what's been done for.
And the reason for it is plastic surgery is an art and a science. And the beauty of it is, what we noticed over the years, and even in training, is the most common type of breast reduction, which is what we call an inferior pedicle WISE pattern, which basically keeps the breast tissue at the bottom of the breast and takes everything at the top and the sides. We noticed that it didn't give the breast a very aesthetically pleasing shape.
It looks flat like a pancake. And so, the good part about, I think, being a good plastic surgeon is you look at your results, critique them, and change. Because, it's, again, definition of insanity, trying to do the same thing over and over and expecting it to look better. So that's what I love about us. And the good part about this practice, we put our egos aside, and we'll look at each other's markings and say, you know what? I don't know if I would do that. This is what I would do. And then you look in retrospect how it comes out. And what I originally thought would look absolutely amazing maybe didn't. And so we've tailored our thought process, our pre-op evaluation, the marking, and how we actually perform the procedure to where it's evolved to what it is today.
And again, what we're trying to say is we want to give you that perfect breast shape. Now, a lot of people come in here and they say, I just want to be smaller. Well, I know you want to be smaller, but I still want your breast to look really good. And that's the difference of, old school method of just saying, let's just whack it out and get you the smallest breast as possible. But no, we want this to psychologically, physically, emotionally, and aesthetically be perfect for you. Now,
I just want everybody to know this is, again, we'll state this over and over again, that this is the number one highest satisfied, or has the highest satisfaction rate out of any procedure that we do, because of the alleviation of the weight and some of the issues that we talked about earlier.
And it's interesting. You know what? I tell the same thing to every patient right as I'm marking them. I say, I'm going to walk in right after surgery in the recovery room, and I'm going to ask you how much better you feel. And I promise you, you're going to tell me I feel like a different person. And to this day, every single breast reduction says the same thing. Mm-hmm. They're like, I immediately felt different because of the amount of weight that was taken off. It's interesting because you don't realize how much weight you're carrying until it's off, and it immediately makes a difference. And people are like, wow, I feel like a different person. Now, not to mention how it looks when you get dressed, how it looks when you put on a dress, how it looks when you're wearing a bikini. It changes everything. It makes your dimensions completely change. I did a breast reduction on an 18-year-old girl who said, I used to wear just saggy clothes. I would wear big shirts because I didn't want people to see that I had really big breasts. Second you gave me a breast reduction, everyone's like, wow, you're so skinny. And it's funny because you don't realize it. And Definitely. It's the same thing when we do breast augmentations for people. We say, don't go too big because you're going to look top heavy. We want to keep them always in proportion. So let's just kind of go over, the indications for somebody to have a breast reduction. And it's interesting because some people may think they've got very large breasts and they're not really as large as they think they are. But generally speaking, there are terms that we like to use. One is called gigantomastia, and one is called macromastia. And gigantomastia just means they're gigantic. And you have to take away at least 1,000 grams of tissue to really give them a decent breast size and a breast reduction. And macromastia is anything above 500 grams. And those terms are really used in our literature, and they're used mostly for insurance approval and for health insurance to pay for this procedure. This is one of the few procedures that as a plastic surgeon, we can have your health insurance cover because it really
improves quality of life.
Absolutely.
I mean, it's, when you look at all those things, the indications and the key words, we look at intertrigo, which is, infections that occur underneath the bra, the breast itself. And then you look at bra strap grooving, because the breasts are so heavy that your bra actually cuts into and slowly weighs down on the shoulders. You have upper back pain or neck pain. And an insurance company wants us to take at least 500 grams of tissue. Now, everyone has a different density to their breast, and so sometimes removing smaller portions will achieve that 500, and sometimes you have to remove a whole lot more. But the goal is, something in our practice too here, I just want to know, we will never sacrifice the shape to hit a number.
Ever.
And so there are always ways of making the insurance company understand, and if we have to get it approved and show photos and document. But the idea is we are not going to keep going until we get 500 grams. We are going to give you the shape that would alleviate all of these symptoms, and obviously talk to you about your preferred sizing.
And that's really important. You took it right out of my mouth. It's one of those things where you're coming in, and I always tell people when they come into this office is, it's like walking into Chanel. You're shopping. You're going to get what you want. So if someone's coming to me and saying, what do you think I should do? I'll give you my recommendations. But realistically, it's what Dr. Layke just said. You have to give us an idea of how small you want to be. And one of the common mistakes and one of the problems with breast reduction surgery is making it too small or too big. And realizing the patient's goals. Now, I've had patients that have come in here. We've had patients that have come in here and they look at us and say, I want you to make me as small as possible. I don't care about the size. And you say, no problem. It is what it is. We understand. And most of the time I say, bring me some pictures. So I understand and I tell them, let's make it proportional to your body. If you're a little wider, if you've got more curves, and your hips are a little bit wider, it's okay to have your breasts stay on the larger side with a nicer shape to it, but yet take enough weight off where it does help you. For others, they want to go as small as possible. We can do that. And remember, the one thing you do, a lot of people come in, they say, I'm getting my breasts reduced. Is this going to be a lift as well? And it's the same theory. Breast lifts and breast reductions are almost exactly the same. The difference is with a breast reduction, you're taking out tissue, which is what's called parenchymal tissue, which is the breast tissue itself, and some fat. And the degree of which people have all depends on yourself. And some people have significantly more volume that is fat, and some is that it's just more breast tissue. So it's very important that when you do go see your surgeon, talk to them about the size you want to be, and don't talk in cup size, because cup size means nothing. It's very arbitrary. Breast cup sizes are very different from manufacturer to manufacturer. So for you to tell me a D and you're a G cup, and we take you down by, let's say, 500 grams, and you still are a double D with Victoria's Secret, don't get caught up on that. Just make it so it matches the rest of your body.
Definitely. Those are like templates when you tell us you want to be a C cup. It gives us somewhat of an idea of what to expect. But I agree with you. Send photos of what you actually prefer, because the same thing happens when people come in for breast augmentation. They say, make me look natural. We'll say, okay, send us photos of what you want. And all of a sudden, a double D comes back and you say, well, this is definitely not what we discussed.
Absolutely.
People have different ideas of sizing and shape. And I would argue most of our studies show that shape will always out-trump size, because to have the perfect shape, no matter what size the breast is always preferable.
Very true.
And the one thing I think in this practice that we do is, if you're going to cheat one way or the other, you're going to take more as opposed to less, because you don't want to leave someone just a little bit too large where they say, gosh, I love what you've done, but we could have gone a little smaller.
Yes.
I'd rather err on the smaller side.
The complaints are more that I'm too big rather than I'm too small after a breast reduction. What I'm going to do is just kind of take you through how this process works. And let's say you're a patient, you come in to our practice, come in for a consultation, you're assessed. We take a full medical history, make sure you are a surgical candidate and you're in good health. And then we talk to you about your desires. Now, one of the main things that, immediately we take measurements and we show you some before and afters and go over everything else, and then get you, if you're interested in having surgery, teed up for surgery. Surgery for most breast reductions with us is under general anesthesia. It takes anywhere between 3 and 4 hours, and you go home the same day.
And this is one of the surgeries where, in that pre-op visit that you're talking about, obviously you want them, depending on the age, to get a certain test, because we are now considering rearranging that breast tissue. What's important for people to understand?
And depending on how old you are, we routinely get a mammogram. And the mammogram that we order, and we normally order it for people that, above the age of 30, maybe 40 is really the big number. But sometimes if you have family history, we'll do it earlier. And the reason we do this is because in practice, we've actually caught cancers prior to breast reduction and have sent people to a cancer surgeon that has taken out their breast tissue. And if they would have never come to for breast reduction, it could have gone years and years and years, and it might have been something a lot worse. So that's the first thing we do. That's our baseline test along with other labs. Make sure that there's nothing there before surgery. Now, once you do the surgery, and in surgery, when we take the specimen out, we always send pathology. The reason we send it to pathology is because there's a less than 1% chance, okay, that there will be a lesion in this specimen that we're sending out that is cancerous. And if it is, then we'll have to definitely go back and do something about it. I will be honest with you, in the, thousands of breast reductions we've done, we still, knock on something, have not had a specimen that has come back as cancer, but we've also done our due diligence and ordered the proper tests prior to surgery so we don't run into something.
Definitely.
After surgery, you're in our recovery room for about a half an hour, 45 minutes, and you go home. I would say that the majority of our breast reduction patients do not take narcotic medicine. They don't take pain medicine. They take Tylenol, and they feel great 2 to 3 days after. It is one of those procedures, and I will say this all the time, breast lifts and breast reductions, I don't want to say they're painless, but they are a very comfortable procedure. Most people feel so much better because the weight is taken off their back, neck, and shoulders that they even forget about the incisional pain, a little bit of incisional pain, but that's it.
And, one of the other things I noticed that you do a lot of, which is great for, the person who, let's say they are a little heavier. And so, when you make those breasts smaller, sometimes they appear a little widened. One thing that you're really good at is you also incorporate liposuction to kind of contour that anterior axilla, the area on the side, really, so you end up with a nice rounded breast shape as opposed to something that's very ovoid or oval.
Very common, very common to add a little bit of liposuction or lipocontouring outside the breast. Because what happens is, and if you've had a breast reduction or if your breasts are larger, you can take a look. And sometimes right by your armpit, below your armpit, you feel like there's a fullness there, almost like an extra breast sometimes. And that's not necessarily breast tissue. It's just a little bit of adipose tissue or a little bit of fat that can easily be contoured through the same incision that you've made for the breast reduction. Very common. I'd probably say 80% or so of all of our breast reductions will do a little bit of liposuction on the outside, and that might hurt more than the full breast reduction. Definitely. You go home. We see you at a week. A lot of surgeons will see you the next day because they want to make sure that the nipple areolar complex or the nipple is viable. We're pretty confident when we do these, and if everything looks great, which normally does, we don't necessarily want to drag you back in the next day. So we wait a week, have you come back, and then the rest of the healing process, there's really just concern about one thing, and that's the scars. Other than that, we make sure that the shape's perfect. We make sure everything else is put together really nicely. But the scarring, there is, a variety of ways that people can heal. And some of that has to do with how you heal. Some of that has to do with how we stitched you up and actually manipulated the tissue. And some of it has to do with the treatment we get post-surgery.
Now, let's stop back on things alluding to scarring and treatment and things like that. But if someone's consulting with you and they say, all right, how safe is this procedure? What complications should I expect, or what's the complication rate?
It's interesting. If you look at a ton of studies, and people have done so many breast reduction studies because this is such a common procedure that's done at major institutions, universities, and private practices. And they've looked at different types of procedures, meaning the different methods, and each one kind of carries a little bit of a different risk, but the complication rate can be as high as 7 to 10%. And when I say complication, it just means that a little stitch popped or one little area of your scar line has opened. Those are minor complications, but they're still complications. And in my opinion, those are the most common, what we call triple point breakdown, because we're bringing 3 different areas and putting them all together. It might be a little tight because we want to make it really tight. There is a complication of losing your nipple and losing your nipple areolar complex, and it depends on how big your breasts are. If your breasts are really big and you're really trying to overdo it and the pedicle's too long, there can be nipple areolar loss or sloughing. And these are things that we speak to each individual patient and tell them so they understand. Even with all of that and the complication rate being up to 7 to 10%, the satisfaction rate is through the roof. So it goes to show you that, really in very common things is one breast may look a little different than the other. One nipple may be a couple millimeters higher than the other. These are all little things, or one side might heal a little worse than the other. All little things that can be remedied down the line. But remember, you're doing a big operation, and if 2 breasts don't look exactly the same, tiny little bit of tailoring can be done to get that.
Definitely. So, I find afterwards that your patients do, really well. Many of them are not taking narcotics. I think that you have them on a specific regimen. I know that we do send them to Remedy Place, and sometimes you'll recommend having hyperbarics and things like that. Do you feel that that's affected your overall results?
I think it's great because what it does is a couple things. You send people to hyperbaric oxygen therapy. It obviously increases blood flow to the area of the scars. So increased blood flow to a scar will make it heal faster, number one. Number two, you'll get what's called less fat necrosis. So when you're rearranging breast tissue, one of the complications could be a little bit of fat necrosis because the blood flow to an area may be a little hindered. So that area of breast tissue or fat may have not as much blood and end up dying. Hyperbaric oxygen therapy helps that as well. And the last thing is, it's very relaxing. So after you've had surgery, a week later, just to be able to kind of calm yourself and sit in this hyperbaric oxygen
Chamber,
bed.
Yeah, guided meditation.
It's very relaxing. And it makes you feel good. And I feel like the patients are happier when they do things like this.
Mm-hmm. Well, it gives them a proactive role on their recovery. And I think that giving tasks like that they know will help improve the quality or their convalescent period, I think, is always worth it. What do you do? Listen, any plastic surgeon thinks they're the best to close an incision and they make a nice thin line. We know that everybody heals differently. What do we do that's different? What do you do that's different?
So I like for every patient to get the same type of post-op protocol. So we like to leave steroid strips on for 2 weeks.
Now he's giving everybody secrets right here.
Giving your
So
secrets.
Go ahead, take some notes.
So 2 weeks of steroid strips. The reason I like to use steroid strips is because there are studies that show that gentle compression on the wound really does help healing. 2 weeks, I'll take them off. As long as they look really good, what I'll do is use something called the Embrace Scar Therapy System. This can be bought at home, guys. You can buy it off of Amazon. It is the only FDA-approved device used for scars. It is the only FDA-approved device that has level 1 data that shows that it helps. And the interesting study that they did is they took a tummy tuck scar, split it in half, treated one half with Embrace, one half with nothing, and they showed that it was so much better. And if you look at these pictures, it'll blow your mind.
Night and day. It just shows however you heal, this is going to make you heal better.
Absolutely. And then around the areola, I don't use the Embrace. And what I use is a silicone scar strip, because you can buy those on Amazon as well. And they're basically, it's a circle that's cut out just like an areola, and it goes and it just sticks right onto the scar around the areola, because honestly, that's that scar that you want to heal so perfectly, because you'll see it all the time. And then we do this for 6 sessions, 10 to 14 days apart, that we put this on. You can do it yourself at home. And then after that, you're basically good to go. You can use regular scar cream. I tell people to avoid sun exposure. If you're in a bikini, put some sunscreen on. And, 6 weeks of no exercise, no heavy lifting, no swimming. And people are back at it, more vibrant and doing things a lot more actively than ever before.
Yeah, we notice a general trend of people losing weight after doing this because it's easier to exercise. What would you say the youngest age you would be willing to do this on in a patient that needs breast reduction?
I like to wait right before they're going to college. So, somewhere right around 18, you can really push it at 17. And we do there's a ton of patients right at that 18. I don't think it's a good idea to do it too much before, even though some people can argue saying that people have reached puberty and they're done with their growth spurt, especially in their breasts. But if you can wait a little bit more, get your transformation right before you go to college, I think it's a safer way to do it.
I know that we've run into this before, and I wanted you to comment on it. Let's say you have an 18-year-old comes in, she's been miserable, and you do a breast reduction. You take 600 grams from each breast. She heals beautifully. Attention to this, people. For those of you who are undergoing breast reduction surgery or revision breast surgery, a lift, or any breast surgery that you're getting revised, what he's about to say is the most important thing that you can bring to your surgeon.
It's very, very important. We have to know what kind of breast reduction or lift was done the first time around. The reason for that is we want to know the blood supply to your nipple areolar complex, because what ends up happening is if you don't know and you like to do a different type of breast reduction and you end up just blowing right through the blood supply, a black nipple is what you're going to get, and it's going to be a big, big problem. So very, very important. If you go to a plastic surgeon who doesn't even inquire about your previous operative report, run for the hills. I just did somebody recently who did a breast reduction like 30-something years ago and came back for revision. The previous surgeon had passed. They couldn't find the reports. And what you do is you just go with the most common type of breast reduction. Discuss with the patient that there is a high risk that there's going to be either wound breakdown, nipple areolar complex breakdown. Most of the time, if it's been 25, 30 years, it's going to be okay. You're going to get what's called revascularization, and the pedicle is going to be intact. But you still don't want to take those chances. So make sure if you're going to go for a revision to another surgeon, take your operative report. That's yours. You can call your surgeon and get it. That person will have the roadmap so they don't run into any problems. Some very common kind of questions that people ask when they do this is, if they're younger, 18, 20, they want to know about lactation. They want to know, hey, am I going to be able to lactate after I do this? And I tell everyone that it all depends on you. But most of the time, you get about 50 to 70% of the people who's had a breast reduction, they can breastfeed. However, here's the big however. The duration of your breastfeeding and the amount of milk production can vary from breast to breast. And some people will tell you, my right breast gave a lot of milk, my left one didn't, and it all depends. So I think you should be able to breastfeed. But remember, breastfeeding will just make your breast sag after time. So don't do it for too long. And the other thing that's really common, very, very common question, and I think it's really interesting how it works, is most people come in and they say, I don't want to do this procedure because I'm not going to have sensation to my nipples. And the interesting thing is it's completely the opposite. When you have very pendulous breasts, when you have very big breasts that have been hanging, they've been stretching the nerves for years. So the chances are very large breasts, people won't have much sensation in their nipples. A breast reduction will actually restore the sensation most of the time if done properly. The nerves that supply sensation to the breast come from what are called intercostal nerves, and that area we don't even get near with a breast reduction. What we do is we take away all that extra weight that's hanging and making the nerve stretch, so when you put it right back up and make it really pretty,
the nerves start firing.
Absolutely. You should have increased sensation or even better sensation. It may take a few months, but you will have regained sensation. More amazing videos just like this one. Watch.
Your body has to fail on me for something bad to happen, which means I don't want to have a heart attack. I don't want to have a stroke. That means that your heart has to have a functional problem for that to happen.